deteriorating cognition, persistent right-sided epileptic fits, and being investigated for acute worsening cognition.
Right, sir.
Okay, so I have given you a flare and a post contrast directly.
Okay, sir.
So you wanted me to come from your mind is oriented from the vertex. So I'm showing you from the vertex down images.
Okay, sir. Sir, in these, sir, the below image
Is a
is
post
that
contrast. T1
post
post
contrast
contrast,
one.
fat satted images or
Okay,
images post contrast. We always do fat satted so that any fat does not mess up with the post contrast. So you anything bright is like a either a vessel or enhancement.
right, sir. Sir, please start from the vertex slowly.
Vertex. Okay.
Explain.
So let's go through this first. Layer first.
Sir, in these images, I can appreciate that on the right side there is a signal.
Right
Uh,
side is you're talking this side where
yes,
my
sir.
arrow is.
Yes, sir.
Okay.
Just upward. Uh, yes, this area on the right side in the centrum semi-ovale region in the subcortical white matter. I can appreciate that there is a uh, hyper intense foci, ill-defined foci. Uh, this ill-defined I would like to see the downward images if there are any other such foci.
Yeah.
Uh, I am unable to appreciate any other hyperintense foci in rest of the brain parenchyma. So I would suspect that this single hyperintense foci could be due to an old ischemic demyelination due to any microvascular injury uh, to the brain. In this region, there is an artifact, sir below. Uh,
Remember, there is a bit of a movement artifact.
yes.
You can see a bit of
Yes,
lines
sir,
going
there is
across.
a
So,
movement
yeah.
artifact in this region, and the basal ganglia are okay. There is no periventricular signal abnormality. Uh, yes, that's good, sir.
What do you see now?
S-
What is the difference you see now between the two hemispheres?
sir, I can. Mm, uh, I can appreciate on the right side. On the right side, there is the cortex. The cortex of the frontal lobe is somewhat distorted in signal, altered signals as compared as
Are
we
you
compare.
talking right side is the patient right side? Remember, this is the left side of the patient. This is the right side of the patient. So, which
Yes,
side are you talking? This
sir,
side?
on the right side. Sir, on the right side of the image. On the right
Okay.
side of
So,
the patient.
the patient right side is this. Remember,
Yes,
this is left
yes,
side.
yes, sir. I am talking
So,
about patient side. On the right side of the patient.
okay, so where my arrow is. Okay, so there I'll keep the arrow on the right side of the patient.
Yes.
Okay, keep going.
I can appreciate that the cortex is some altered signals in the cortex of this patient. Uh, mm,
Okay, so you see, okay, so let me sum this up. Um, for you, you can see some altered signal in the frontal lobe of the patient on the right side. You can see an old infarct, suspected old infarct, and that's what your description was. And what about post contrast? Do you see anything in the post contrast?
sir, on the abnormal T2 areas, flare areas, I can't appreciate any signal abnormality on the T1 post contrast. images. Uh, s- uh,
Okay. So what do you see so far?
uh, Sir, I cannot appreciate any significant abnormality on the T1 post-contrast images in the, but I would like to focus on the posterior fossa on the T1 post-contrast. Mm.
Yeah.
The,
What do
cere-
you see?
the cerebellar hemispheres are normal, the vermis is normal, the pons is normal. Uh, uh,
Okay, so let me take you back to the flare sequence. Do you see any? Now I've changed the window, and do you see anything?
Sir, on the right side of the patient, there is a decrease in volume of the cerebral cortex of the patient in the frontal region,
Mhm.
and it corresponds with the history of decreased in cognition of the patient, as you described. So there is a decrease in the volume of the cerebral cortex in the frontal region. I would suspect, I would look for the reasons why there is a decrease in the volume of the cerebral
What are you
cortex.
suspecting? What is your differential diagnosis for that?
This meeting is being recorded.
It has hypertrophied, and this decrease
Okay,
in blood
so
flow most
no
likely.
problem. So, okay, what do you see on this study? This is a diffusion weighted sequence I have shown you. What do you see? What is this? Why is this cortex so bright in comparison to the other side? Look at this. This cortex, this area, caudate nucleus, this including bilateral occipital, cortical area, they are very bright. Why? There is a rapid decline in cognition.
Sir, this decrease in this diffusion restriction of the cerebral cortex specifically determines that there is a decrease in blood supply of the cortex, because the cortex is highly susceptible to brain ischemia. Even the slight change.
Ischemia, remember, ischemia has got a very classical history.
Uh, so this diffusion restriction specifically in the cerebral cortex, I can't think of any other cause except uh, that this restriction in diffusion in the cerebral cortex that is a highly susceptible area to the even slight changes in the brain blood flow dynamics. So there should be a difference. There should be. Uh,
There is
Really, I
another
would like to see
condition.
the ADC images if there
There
is
is
ADC images available.
there is another condition that gives you this type of a bright with this classical history of an epileptic fit, rapid decline in cognition with cortical diffusion change like this. This is a classical pattern for a sporadic CJD.
Oh,
So
right, sir.
always remember this is very classical. It does not obey any vascular territory. It is not obeying any vascular territory. It's bilateral occipital, vertex. This is a the CJD has got two types, sporadic and the pulvinar sign. That is usually the medial thalamus that gives the but the sporadic variety gives you diffusion high signal, and I showed you the flare high signal too that it gives. So I changed the window for you. This is the change window. So look at this. Does not obey any classical pattern. It has got a classical history and it has got a classical imaging pattern.
Right, sir.
Okay, the reason why it is very important to diagnose this, the clinical significance of this is that if this patient is going for any operation or anything, they have to quarantine all the equipment. So it is a vital and a crucial diagnosis. Luckily, it has got quite a diagnostic history and a quite a diagnostic appearances.
Right, sir.
Okay, good.
Yes, sir.
Excellent. Let's see another case.